Oh, what good stretchies. What good stretchies. I know. That's a happy boy. Bless you. Bless you. Over here. Over here. Over here. Come on. Lance. Over here, buddy. Over here. This way. This way. This way. Almost there. Almost here. Nope. Come on. This way. This way. This way. This way. This way. This way. Come on, baby. Come on. Oh, oh, oh. We gotta poop. Whoops. Whoops. Whoopsie. Okay, let me clean that up. Hi, Bubbles. You did a poopies? Yeah, you did. That's my good boy, Lance. Careful, careful. Don't step in it. I know. I know, you don't know. Try and get the bag open with one hand. Okay, hold on. All right. Here we go. We got it. We got it. We got it. We got it all cleaned up. Yes, we did. We got it all cleaned up. Yes, we did. That's my best little guy. That's my best little guy. Hi guys, good morning, good morning, good morning. This is Tiffany, Rescue House 1 with our little Lance. Hey. I know we haven't been real active lately. We've had a lot going on. Plus I was sick for like 2 weeks. So haven't been doing a lot of videos. So I know you guys have been asking to see Lance. So I figured I would jump on to give you guys a quick update to show you Lance and how he is doing so far. I am seeing a couple people asking if he is blind. Yes, he is. He is completely blind. Lance was the dog that we pulled from Miami-Dade Animal Services. The picture that we saw, he looked like a Shih Tzu that was completely neglected. The hair was so long you couldn't even tell what kind of dog he was. We placed our hold. We were told he had an adopter. And then a couple of days later, we received the email to come and get him, that the adopter dropped their hold and didn't want him. So I ran down to Miami-Dade to pick him up. When they brought him out to me, he was in a crate. They said he was biting, that he couldn't be handled. He was in a really bad place. He was terrified. He didn't know what was happening. He's clearly blind. And we made an appointment with the neurologist, Southeast Veterinary Neurology, immediately. Got him up there, had the MRI done, and found out immediately that little Lance had a very severe case of hydrocephalus. He has so much fluid on the brain that when you look at the MRI scan, all you see is white. He's even got fluid pushing on his spinal cord. So it's a pretty severe case of hydrocephalus, and he has most likely had it since birth. We got him started on prednisone immediately following that appointment, which was not an easy task, because in the beginning he didn't want to eat anything. He was turning his nose away from everything, every kind of wet food, boiled chicken, Waruva chicken, dry food, baby food. He just wouldn't eat for us, which is very common with hydrocephalus dogs, because they don't know they have to eat. because their brain function is not great. So it was a struggle in the beginning, but then we were finally able to get him to eat and get him to take his prednisone. We have to crush up the prednisone and stick it to dry food, and that's the only way we can get him to take his meds. It's the only kind of food he will eat now, is dry kibble. He loves it. And we got him started on omeprazole as well, so he gets both of those with his food. But it's still, we still think we can give him a better quality of life. We talked to the neurologist, we discussed it, and they said he was a candidate for shunt surgery, which basically they go in, they place a shunt in his head, drains into his belly, and it relieves the pressure, it relieves the fluid on the brain, and will hopefully give him a better quality of life. He will be less confused. He'll be, more here with us and with it. Walk better, eat better. We were hoping maybe get some vision back, but if he's had hydrocephalus his whole life and has been blind pretty much his whole life, we're not overly thinking he's gonna get his sight back, but we're still hopeful. You never know, a miracle could happen. Hi. Hey, honey. Here's my sweet boy. That's my sweet boy. Yes. So he is going in tomorrow morning up to Boynton. I will be driving him to Southeast Veterinary Neurology, where he will undergo shunt surgery. It is a long surgery. It is at least 3 hours long, and that is saying that they don't run across any complications or any problems. But he is having his surgery tomorrow along with Balto. Balto, of course, you guys know as well, has hydrocephalus, and he has been on omeprazole and he has been on prednisone, and he has started to decline even with the drugs. He's not up and running and as happy as he was. So we decided the best thing that we could do for Balto was give him a chance and have the shunt surgery done for Balto as well, to see if we can give him a better quality of life. So both little Lance here and Balto next door are going in the morning, first thing, to Southeast Veterinary Neurology. They are both having the 3+ hour surgery done. They will both be staying up there at the neurologist for several days while they recoup, to make sure that there is no complications, to make sure there is no issues and that everything is good, prior to them coming back to Rescue House 1 and Rescue House 2. So I wanted to jump on to give you a quick update of Lance, and to also ask you guys if you could please donate towards both of these surgeries. It is very costly. I don't know the exact number. We'll have an exact number tomorrow when we get up there for the estimate that we're going to have to sign when we bring them up. But I know it's going to be very expensive, and times 2, because both Lance and Balto are having the same surgery done, and both Lance and Balto are going to be staying in hospital with 24-hour care for a couple of days after surgery. So I did put the donate button on this video so that we could ask you guys to please donate towards both of these surgeries that our little babies are having tomorrow. It is their best chance for somewhat normal of a life. You know, having fluid like they have on their brain, it's got to feel like, imagine if you were walking around with a constant migraine 24/7. That pressure, that feeling of, you know, and it makes them nauseous. It makes them not feel good. It messes with their eyesight. So if we can do this surgery and give them some relief from the fluid, give them some relief from the pressure, you know, maybe some of the neurologic signs will start to dissipate. They'll start to feel better. They'll start to walk better because it's not affecting those parts of their brain. You know, hopefully Balto will be up and running around and happy and playful again. And that's what we're hoping for. That's our number one concern, is just trying to make these two babies as happy and normal and feeling good as possible. Hi, baby. Hi, honey. But like I said, it is double the surgery, double the hospital stay, and it is going to be very costly. Hi, baby. There's my Lance. How's my little Lancey? It's not too hot, right? There's a nice little breeze, plus the fan. Nice to get some fresh air. Hey, honey. Hi, baby. Hey, Lance. Hey, Lance. Yeah, so we're all very, very nervous, of course. You know, we're going to be holding our breath the entire day tomorrow, because these two babies are very, very special to all of us here at 100 Plus. So, needless to say, there will probably be nobody sleeping tonight, and we'll all be nauseous and holding our breath all day tomorrow. But we know it's in their best interest to do this for them. So that's why we're doing it. And we're going to be cautiously optimistic, and we are going to pray that it gives both of them the relief that they need to feel better and improve their quality of life more so than it is now. You hear the birdies? Do you hear the birdies? Hi. Hey, Lance. Now you hear the planes. Oh, my sweet boy. That's my sweet boy. So again, we are asking for your donations for the surgery, and we are also asking for all of you to please say a prayer tonight for Balto and Lance, that the surgeries are successful, and that they come back here home to us at Rescue House 1 and Rescue House 2 feeling better, acting better, and just having a better overall quality of life. That is what we want for them more than anything. Right, my little Lance? Hey, my little boy. He's my little boy. Hi, honey. Oh, there he is. Thank you for the kiss. Thank you. Thank you. enjoying the fresh air and the breeze out here. Thank you to all who have donated so far. Like I said, I don't know how much it is going to cost, but I know it is going to be expensive, and I know it is ×2 because we have 2 of our babies undergoing the same surgery and extended hospital stay. Hey, my little guy. Hey, my little guy. That's my sweet little boy. That's my sweet little guy. Lance, they believe, is around 5 or 6 years of age. And they believe he's had hydrocephalus his whole life. I will tell you, from day one of having Lance, once we were finally able to get the prednisone and the omeprazole in his system, there has been a huge difference in him. I can even see it in his eyes, where his eyes are looking more straight on instead of, you know, you could tell he had so much swelling in his brain when we first got him that it actually made his eyes look a little wonky, like they were off to the side. And now his eyes are straight on. He's calmer. He walks a little bit better. So being on the omeprazole and the prednisone has already helped him so much. So we're hoping the shunt will help even that much more. Hi, buddy. We were hoping he might get some eyesight back once he has the shunt in place, but if he's been blind for years, the neurologist said the chances of that are very slim. But you never know. We could get a miracle. You never know. He is a precious, precious little boy. And it just kills us to know how long he must have been suffering alone on the street, neglected, trying to find his way, trying to, you know, I don't know if he was kept in somebody's backyard and just like tossed in a backyard and left there for 5 years. But his hair was so overgrown, being blind, feeling terrible. Like, it just kills me to know what he has been through. Because he has such a sweet little soul. Right, little Lancy? So, of course, tomorrow we will jump on live again when we get up there to the neurologist with both of our boys, Lance and Balto. We'll also have an estimate, so we will know more of an exact cost of the 2 surgeries and the extended hospital stay after surgery. Hey, buddy. That's my best boy. Thank you for the kiss. I love when you give kisses. I love when you give kisses. That's my good boy. That's my good boy. That's my good Lance. Is that my good boy? Is that my good boy? Can you give me a tail wax? Can you give me a tail wax, little man? Sweet little guy. Such a sweet little guy. Hi. Hi, baby. I'm still right here. Yes, I'm right here. Right here. That's my good boy. That's my good boy. So again, guys, thank you to all who have donated so far for Lance here and our Balto next door, both going tomorrow morning to Southeast Veterinary Neurology, both undergoing shunt surgery, and both staying a few days for around-the-clock care at the neurologist's office. Hi, sweetie. Hi, sweetie. The Parvo pups, you might have missed the video yesterday. They have been released from the hospital. They all test negative, and they are back with our amazing Nana Christine and Bob, and acting like happy, happy puppies. Buddy. Hi, my little Lance. That's my little Lance. That's my little Lancey. That's my good boy. That's my good boy. Alright, guys, I'm going to sign off. Just wanted to give you guys an update and let you know what was happening tomorrow. And please donate if you can for both Lance and Balto. And everybody that does pray, please pray tonight for a successful surgery for both of our boys. They are so special to us. Hey. Hey, baby. Hey, baby. So this is Tiffany with Lance, Rescue House 1. Balto is next door. And our babies need all of us right now. 100 plus abandoned dogs of Everglades, Florida. Thank you all so very much.